I want to come to you, Dr. Brooks, because you have a slightly different perspective on this. Although you believe in vaccinations, you do have unvaccinated children in your clinic. Why?
Absolutely.
Why do you disagree with Dr. Ball?
Ultimately, if they don't come to me, then who's going to take care of them? Parents don't choose to not vaccinate because they think that that's not good for their children. They truly believe that they're doing the right thing. So they need to come to me or those that truly believe in vaccinating so that we can talk to them, have a one-on-one discussion to secure their trust and, in fact, get their trust. As a pediatrician, I have to care for them. If they, for example, don't come to me, they're going to go to someone else. Do they go to another doctor who also doesn't endorse vaccinations? Children are your patient. It's not the parent. The child did not decide not to get vaccinated. The mother, the family decided not to get vaccinated. So when they come to me, I will work with them and care for them. If I don't, then who will?
So I think that's laudable, and I think that's a very great approach, that they will get better information from you. But I'm curious what steps you take then to convince parents who may be against vaccination. How do you sort of try to bring them into the fold?
So there is an approach that came out of a group in Michigan. It's called AIMS. Announce that you believe in vaccines and you will get the child vaccinated. If they have any kind of disagreement, then you inquire. It is really important to find where they are coming from. Understand that these patients, these mothers, these families, they love their children. They feel like they're doing the right thing. They just aren't, quite frankly. So then I find out, what is it? Is it that you think there's a government conspiracy? Do you think that these illnesses no longer exist? Are you going to treat your child with exercise and alkaline water? So when you talk with them, then you come to where they are. And then you speak back to them. What is it now? Is this the truth? You really believe that you don't need this because these illnesses are not serious? Now, address the fact that 1 to 2 children a year die from measles when we were having that many cases in the thousands, 1 to 2 per thousand. So then S, announce, inquire, mirror back what they're thinking, then secure. You secure one of two things. You either secure their trust, in which they'll come back to you, or you secure them getting vaccinated. So I work with them in that fashion, and that family will stay with me.
I'm curious, Dr. Brooks, do you have a paradigm in place to avoid a situation like Dr. Ball experienced in his clinic where, let's just say you do have an unvaccinated child coming to your clinic? How do you protect your other patients? Because I really respect what you're doing, but how do you protect the kids that are, that are too young to get vaccines, but their parents do believe in them?
Right, so if you have a patient that doesn't get vaccinated, a patient is unvaccinated, theoretically what you do is you screen them. So you screen them for fever, rash, or anything else that you think might potentially make them contagious. But if you really think about it, a doctor's office is full of sick people. So even when they come in, someone maybe have a 2-week-old child, there may be another child over there fully vaccinated, but they have influenza and don't know it because it's October and they haven't gotten vaccinated yet. So there's always a risk when you go into a doctor's office.
But there are in addition to measles, other communicable diseases that children can carry that could be prevented by vaccines in addition to measles, right? Hepatitis, we talk about influenza, whooping cough.
The big one is pertussis.
Yeah, whooping cough.
Just go right there. So again, child's unvaccinated, they potentially could get pertussis and spread it to other people. But pertussis is primarily contracted from the mother or the father. More than 50% of children who get pertussis get it from their mother and father. It's not being in a doctor's office with some kid who may have been exposed, who now may be in his incubation period, who is now spreading it, and then to this child who's unvaccinated.